With strict safety and control measures put in place, the country's health sector was able to prevent maternal deaths occurring during the first wave and second waves of COVID-19. However, the virulent spread of the third wave of COVID-19 that swept across the country following the Sinhala and Tamil New Year has seen an increase in the number of maternal fatalities.
The Family Health Bureau of the Ministry of Health has looked into the maternal deaths due to COVID, and in the third wave there have been around 10 deaths reported. When these deaths were investigated in details, they have realized that delaying in seeking medical help has significantly contributed to the death of these mothers. If any pregnant mother is feeling any difference or any new sign or symptom or any discomfort related to her pregnancy or a change in her health condition, immediately seek medical advice. And the Ministry of Health is offering the COVID vaccination to pregnant mothers in their second and third trimesters and who are having risk factors. Please speak to your doctor, MOH, and get your COVID vaccination.
Meanwhile, during yesterday, the number of COVID-19 infections detected across the island stood at 1,717. The figure included 1,709 infections detected in 24 districts and 8 foreign arrivals. No infections were reported from the Kilinochchi district this time. In contrast, the highest number of cases were confirmed in Colombo with 348. In addition, 280 cases were detected from Gampaha, 198 from Kalutara, 113 from Galle, 93 from Ratnapura, 89 from Ampara, and 86 from Puttalam. The remaining 502 infections came from 17 other districts. All of these infections were detected after 16,943 PCR tests were conducted by health officials. In the meantime, health experts once again highlighted the importance of adhering to health and safety protocols in public, saying that even vaccinated people who may remain asymptomatic could still spread the virus to others who are not vaccinated.
It is possible to spread the disease through asymptomatic patients. That is basically because the persons who are infected with COVID-19 does not or show minimal symptoms if their immunity is very high. And however, high immunity or even after vaccination does not imply or indicate that they will be prevented from getting the infection. So therefore, even those who got the vaccination or those who are with high immunity will be infected if they are exposed, and probably they will not show any symptoms. However, since their immunity is high, they are relatively low spreaders, or the likelihood of spreading the disease from these people are low. But if somebody is susceptible, definitely they can get the disease through these asymptomatic patients. That is why we always advise to ensure health measures even when you are working or interacting with so-called apparently healthy people.
Meanwhile, in the country's vaccination drive, 925,242 people have so far received the AstraZeneca first dose. The number of people who have been inoculated with both the AstraZeneca doses as of last evening currently stands at 375,784. In the meantime, the number of first dose receivers of the Sinopharm vaccine as of last evening increased to 1,657,741 after 61,255 people received their jabs yesterday. The number of second dose receivers of Sinopharm now stands at 605,116. As for the Sputnik vaccine, 114,795 people have received their first doses, while 14,425 have obtained both. Meanwhile, the first dose of the Sinopharm vaccine was administered to people aged above 60 years at several vaccination centres established in hospitals across the Western Province. In the meantime, 2,481 COVID-19 patients were discharged from hospitals during the day, increasing the country's total recoveries to 225,952. The country's number of active cases, meanwhile, rose to 30,074 after the National Operations Centre for the Prevention of COVID-19 confirmed 1,786 new cases today.
Pocket එකට ෆිට් වෙන new Axe Ticket perfume.